Hello and welcome to Aging Insights. I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. During these uncertain times of still dealing with COVID-19, we can't help but wonder how much longer this will impact our daily lives and routines. And as the summer begins to wind down and we think of things that normally happen in the fall, I bet you're thinking about open enrollment and whether or not COVID-19 will impact your ability to make healthcare decisions and make any changes to your coverage during that period. So today we're joined by our two favorite Medicare experts, Mary McGeary and Charles Clarkson, who are going to tell us all about the things we can do during open enrollment and the impact of COVID-19 on not only those services, but also their programs, and of course tell us about changes to Medicare coverage and warn us about scams that are coming up. Great. So really, Mary and Charles, I'm so grateful for you both being here to share information with our audience. Mary, if you could just start us off with telling the audience what the SHIP program is and and how it helps people.
Sure. Well, SHIP is a federally funded program that helps folks on Medicare understand their Medicare coverage. It's a free program, and we have almost over 400 counselors available all across New Jersey to meet with folks locally to help anything from folks that are new to Medicare to help them understand how to enroll in Medicare. And every year we especially help folks understand the Medicare options on how to get their coverage and their benefits.
Great. And I know, obviously, as everything has been impacted by COVID, that the SHIP counselors and the SHIP services as well have been impacted in that, people can't necessarily come in and meet face-to-face with a counselor, which is something they could do previously. So how have you been dealing with that and adjusting the services?
Yes, well, we had to shut down our face-to-face appointments, but we are assisting folks by telephone, and that's been working really well. We also can help folks if they have access to email. We can email information back and forth. Our SHIP sites are open for staff, so if we need to mail out information to folks, we can also do that by mail.
And then Charles, of course, our audience is just as familiar with you as they are with seeing Mary, come and join us and talk about Medicare. But could you remind them what the Senior Medicare Patrol is and what you all do there?
Yes, well, like Mary's program, our Senior Medicare Patrol is federally funded by the Administration for Community Living. Every state has a Senior Medicare Patrol. The Jewish Family Services of Middlesex County has the grant for New Jersey, and I am the project director. And our mission is quite simple, really, to educate seniors about Medicare fraud, waste, and abuse and how to protect themselves. So the motto is, detect, protect, and report. So, and that's what we try to teach, and we cover the entire state of New Jersey.
That's excellent. And, and you both truly are my go-to people when I have questions about Medicare. And so I'm so grateful, as I said, for you joining us to share that information. And so if we could just start out like we normally do with the basics and remind people what Medicare is and, who's eligible and maybe, if at all possible, a brief explanation of the parts of Medicare.
I'll start. Medicare is a health insurance program that's nationally run, and it's available to three groups of individuals: those who age into Medicare, and 65 is the magic number to be eligible for Medicare benefits. It's also available to those who are disabled and younger than 65 who are collecting Social Security disability. So Medicare benefits are available to those individuals as well. And lastly, the third group are those with end-stage renal disease of any age can access Medicare benefits to help with the conditions to treat end-stage renal disease.
Yeah, the four main parts, right? Is that the gist?
Yes, that's right. So Medicare has actually four separate parts. They're labeled by letter A, B, C, and D. A is the hospital or inpatient insurance. Part B is the medical insurance that covers you for most things you think about with health insurance: doctor's visits and doctor services, outpatient services, medical testing, and medical equipment. Part D of Medicare is the prescription drug component, and Part C of Medicare is an optional way to get your Medicare benefits, where you would get your Medicare benefits from a private health insurance company that contracts with Medicare, and those are managed care plans. So that's where you get your health benefits for hospital and medical through an HMO or a PPO type of program.
And both Part B and Part C have premiums, correct? And so that's the cost associated with having your Medicare benefit, is that there's a premium for Part B, and then if you choose to go with the Medicare Advantage, you would have a premium for one of those carriers as well. Yes?
Not always. Some of our
Not
Medicare
always.
Advantage plans are a zero premium plan, but definitely Part B has a monthly premium, and Part D drug coverage will also have a monthly premium. So when we talk about cost sharing, we talk about premium, we talk about deductible, what the person has to pay out of their pocket before the plan covers, and then we talk about cost sharing. Every time you get a service, every time you get a prescription, there's a cost share that the member pays whenever they get that service or that item.
And we also know that for people who might have trouble paying those, there are programs that help you to pay for your benefits as well.
That's correct. They're called Medicare savings programs. So for our very lowest income individuals, there's something called Medicaid. Here in New Jersey, we call it New Jersey Family Care. And that helps with all of Medicare costs, the premiums, the deductibles, and the cost sharing. Then we have a program for those that are still low income, but not quite as low for Medicaid, that help folks afford the Medicare Part B premium, and that program is called SLMB, SLMB. And also in New Jersey, we are very lucky that we have a very generous prescription assistance program. We have two programs called Pharmaceutical Assistance for the Aged and Disabled, known as PAD, P-A-A-D, and one called the Senior Gold Prescription Discount Program. Both of them are very generous programs that help folks afford their prescription coverage in terms of their Medicare Part D costs, and could get their prescription copay at the pharmacy counter down to as low as $5.
Wow. And people can learn more about those programs by, I'm sure, calling a SHIP counselor, but also the Division of Aging Services has a lot of information on their website, correct? Where they maybe learn about eligibility levels and things?
That's correct. So our website is agingnewjersey.gov. Where you find information about these Medicare savings programs and about the SHIP program. We also have a toll-free hotline folks can call, 1-800-792-8820, or folks can also call their county office on aging. Every county has an office on aging, and they can do a whole benefit screening to see what services and benefits individuals are available to them.
Excellent. That's excellent. And we know, as I mentioned, that COVID had an impact on the services that SHIP provides, or how they provide them, I should say. They're still obviously doing all the great work that they normally do, just in a different way. And so were there also some changes or responses from the Medicare program in terms of coverage of COVID-related things, or changes that people should know about that are COVID-related?
Yes, Medicare was very responsive when the public health emergency was announced. First of all, folks should know that COVID testing is fully covered by Medicare. There's no cost sharing involved with it, so you can get COVID testing anywhere from Medicare providers, and Medicare will cover it in full. Medicare also did a lot of waivers to allow folks access to the benefits during this time. So example, you can get a 90-day refill on your prescriptions. For sometimes you're only available to get a 30-day refill before. They're allowing home delivery of prescriptions if the pharmacy offers that, where normally Medicare didn't cover some of those things before. They've also expanded what they call telemedicine services that used to just be covered under Medicare really in rural areas. But now we know that it's dangerous for many folks to leave their home and go to public settings for health care. They're allowing now Medicare doctors to provide care and consultation over the phone or over the computer or over FaceTime on their phone, both for evaluations and just questions when folks want to talk to their doctor about it. Those things are now covered by Medicare during this time where a lot of folks don't want to go outside and expose themselves. Mm-hmm. Okay. Charles, did I miss anything on that? I know you've been following a lot of the COVID waivers.
No, I think you've hit most of the main points. There has been so many waivers during the COVID-19 crisis. It's almost impossible to keep up with all of them. For instance, like the privacy waivers are not being enforced. So you can do maybe Zoom outreach to people, and you may not have to worry about the fact that it doesn't meet the HIPAA requirements. So those kind of things to make it just easier for people, whether or not they accept all of these as permanent going forward after the crisis end is still an issue. And From my end, when I talk about fraud, I like the idea of not keeping many of these things because it's too easy to cheat, but we'll talk about that in a little while.
Yeah, please. We will definitely get to the fraud issues that have come up, but I appreciate you mentioning that, Charles, because while they are great things that help people access their benefits and receive care during this difficult time, they are also ways where people can take advantage. So if things are here to, some of these things are here to stay, we want to make sure that we're looking at ways to keep people safe and keep their information safe. Speaking of both the SHIP and the SMP program helping people to stay informed, one of the biggest things we always reach out to you both for is to talk about open enrollment. And we know that open enrollment is coming, but that it might be a little bit different in 2020. So if you could just maybe remind our audience what open enrollment is and when it happens first, and then we'll jump into the other stuff.
Mm-hmm. Yep. Well, Medicare has an open enrollment every fall. It starts October 15th and goes through December 7th. And as far as we know right now, they're not changing those dates because of COVID, so it still will be that period of time. And during that period of time, you can change the way you get your Medicare coverage. You can change your prescription drug plan during this open enrollment period. You can change from original Medicare A and B into a Medicare Advantage plan if you prefer. Or if you're already in the Medicare Advantage plan, can change to a different Medicare Advantage plan or go back to original Medicare. So it's really the Part C and D sections of Medicare that affects open enrollment. And it's very important to review your coverage during this time because those private health plans and Part D drug plans change significantly from year to year, both in terms of what the premium is that they charge for the plan. They could also change the benefits that they offer. So you want to shop around and make sure you're in the plan that has the best benefits for you. So open enrollment is a very busy time for us because of all the changes going on. But beneficiaries should really review their coverage during that time to know how their current plan is changing if they're going to stay in that current plan, and to shop around to see what other new plans are being offered for the following year.
I know in the past, Charles, you've encouraged people to look at their Medicare summary notice during that time as well, right? Is that a one way, and what are some other tools that both of you are aware of that people can use to check their coverage and compare?
One of the things I want to mention is just because your plan is currently working for you doesn't mean that's the best plan that's going to be available in the following year. Remember, the open enrollment is effective January 1st of 2021. So you always want to make sure that you review, especially Part D. And I know, like, if you're on insulin, for instance, there are some new pilot programs to allow the insulin cost to be pushed way down if you join one of the plans that offer that. Not every plan is going to be in this program. So you always want to check every year just to make sure. And, sometimes you may not be happy being in a Medicare Advantage plan. Let's say you say, wow, gee, some of my doctors dropped out, or, I have to pay a copay every time I go. So I might want to go back to original Medicare, or I might want to change the Medicare Advantage plan because some plans are now offering additional supplement benefits, which the law is now allowing. So like transportation or Meals on Wheels, and not every plan is offering every benefit. So it's really makes sense to sit down and look at these benefits. And, I really can use that, especially I don't drive. I need to go to my doctor. They're offering 30 one-way trips. That would be great for me. And, that would be helpful to people. But you really need to review the plans in order to make that determination.
Absolutely. And what are some ways or tools that are available for people to do that research?
Well, the Medicare has a plan finder, which they're always tweaking with, and hopefully there have been some new changes this year. And so you can look up these Medicare Advantage plans based upon the benefits they're offering. That's one of the filters you can do. You could also, there's more information now if you're an original Medicare about Medicare supplement plans, which also run by letter and very confusing, like A, B, C, D, F, and so, it's a lot of information. So, and Mary is right, SHIP counselors are trained to do this, and Medicare is complex. Let's just leave it like that. And why not get the help that doesn't cost you anything?
That's a great point, and that's I appreciate you bringing that up because Mary, I'm not sure that we covered that. I mean, I think it's pretty commonly known that there's no charge for ship services, that it's a volunteer program, and people can call because now that's the best way to get help is by phone. So people can call that hotline number that you gave out and ask questions about the changes that they can make during open enrollment, or getting advice about the best way to compare their plans. If it's objective, they don't give you advice as to what to pick, but they help you in comparing the plans and in figuring out what your needs are, right?
That's correct. So our SHIP counselors are well trained on that, on using the Plan Finder tool. So when you call a SHIP counselor during open enrollment and you want to compare your costs in a Part B drug plan, for an example, we will get from you the list of prescriptions that you take. We will type it into the Plan Finder, and that tool helps us to compare all the plans that are offered. And in 2020, we had 28 plans, and it comes up with the best plans for coverage for you based on what plans cover your prescriptions on the formulary, because you don't want to enroll in a plan that doesn't cover your drugs under the benefit, and also compare the cost for that. So the Part D plans in particular, the premiums can range from $26 a month up to $126 a month. So it's a very big range, and it's hard to choose from the plans. So SHIP counselors can help you use that Medicare Plan Finder tool to pick a plan that has the best coverage for you at the best cost based on your prescriptions, what the plans are covering those prescriptions at.
And I think it's a great reminder that, sometimes things change. You might be on a medication now that you weren't on when you picked your plan last year. And so checking what that coverage is, or if there was a change, you might be off of one medication and on a new one. And so it's a great time to look at that. So let's just remind folks, this is the open enrollment period is October 15th to December 7th. And
Correct.
any changes you make in that period take effect January 1. So these are changes for your 2021 coverage.
We also want to advise folks that there's a lot of press during this time. You'll see a lot of television ads for plans, trying to get your business, a lot of marketing material through the mail. You want to be wary of any phone calls that you get from companies trying to sell you something over the phone, because plans are not supposed to call you what they call a cold call out of the blue. So folks want to be really wary about the marketing that's out there and advertising that's out there, and ask the right questions about these plans. Make sure that it's right for you, that your doctors and hospitals that you want to use are covered in the plan, your prescriptions are covered, and fully understand these supplemental benefits that Charles was referring to. They may say, yeah, we have dental coverage. You want to know the details about that dental coverage. Is it just routine dental they're going to cover you for cleanings and checkups, or is it more a comprehensive type of dental that'll cover you for crowns and root canals, as an example?
Yeah, that's great. I really appreciate that added extra information. And I think it's really important for folks to remember that you do have to be careful about that. And we'll talk with Charles more in a minute about the scams. But I just want to remind people that if they do see advertising and they're not sure, the best place to get information is not only from your two programs, but they should go directly to the Centers for Medicare and Medicaid, right? They should go to medicare.gov, and that's where, if there are any changes to the dates or anything, we're not anticipating that for open enrollment, but all of the information from the government about open enrollment and all other Medicare coverage will be correct at that website, and not to rely on the things you're hearing necessarily in advertisements, and
Right.
definitely don't take those phone calls, right, Charles?
Right. One word of advice I tell people is take all that mail and throw it in the garbage, and go to the SHIP program or look it up yourself on Plan Finder, because these are just solicitations so they could get people to enroll and make money. That's how they make their money. So please be careful and ignore all the TV commercials, especially one with a famous football quarterback.
Yes, I was going to say, people call. I know that I talked with a SHIP counselor not that long ago who said that she had a lot of people calling her saying, I want the plan that so-and-so endorses, because they put celebrities in these commercials sometimes, and people want that coverage and those things. So it's good to know that there are programs here that are addressing those concerns. And so, Charles, I do want to spend some time talking with you about scams, because as we know that we always cover different types of fraud and scams that happen in the Medicare program, but as with everything else, COVID has also opened up a window for people to take advantage. So can you tell us a little bit about some of the newer scams that have popped up and things that people should look out for?
Sure. Okay. Obviously, whenever there's a new scandal or pandemic in this case, the fraudsters come out of the woodwork, as we say. So we have to be even more alert to some new scams related to the COVID-19 pandemic. So I'm just going to give us some examples that we've seen in New Jersey and obviously across the nation. One is fake testing sites. In New Jersey now, you've seen that you can go out and get a free test. You don't even have to have any symptoms in order to get this test now. But make sure you go into a legitimate testing site. Don't just go into a parking lot where people are in uniforms that may not have the official uniform. So, you can look it up. You go to the Department of Health in your state, look up the testing sites. You may have to call in advance. You may need an appointment, but that's certainly one of the things, because we've heard of trucks being driven into parking lots, setting up signs and uniform, taking tests and Medicare information, obviously, is what they want, and then throwing them in the garbage. But now they have your personal information. Be very, very careful of door-to-door solicitations. The CDC, which is the Centers for Disease Control, are not sending people door-to-door to offer testing kits or cures or other treatments. So be very, very careful about that. And that's true of any fraud. Always be wary of people knocking on your door. We want people to be really aware of phishing, because now even seniors and most people have an email account. So if you see anything that looks official, let's say from the CDC, for they'll send you a testing kit or they have some treatment options. Well, CDC is not sending out emails to people across the country offering these kind of services. So those are called phishing, and that means they want to try to get you on their site so you will add personal information. And once your personal information is out there, then it can be shared across the world.
Yeah, I just want to make sure people do understand when you say phishing. I appreciate the explanation that it comes through email, and that it's someone, a scammer, posing as a legitimate site. So it might say it's from the CDC, but there are some clear signs to look for when something, we always tell people this with their bank too, that if it looks like it's coming from your bank, to make sure that it actually is your bank by calling the main number. So go to the CDC's official website, or look for misspellings, or don't click on any links if you're really unsure that email is not legitimate and that it might be a phishing scam.
Yeah, even if, it's very rare for institutions to send emails like that. So even if it comes from a bank that you may be banking at, don't presume it's the proper, email. Don't click on it. Don't open it. If you need to call your bank, call them with the number, and then ask them the proper question. Have you sent this to me? That kind of thing. And it's very rare that they have. So you have to be very, very careful. Now, we mentioned the great, expansion of telehealth services, but this also poses a problem, for Medicare and scams, because any provider can now call any beneficiary, even across state lines, and offer them telehealth services. So we're basically recommending deal with your primary physician or the physician you go to. I'm sure many of them, and probably almost all of them now, are offering telehealth services for their clients and patients. So use them. Don't accept, a telehealth service from someone you've never heard of, from a provider, because now they're getting paid for all these telehealth services. And, and we're talking a lot of money. And, in some cases, we've gone from very few telehealth services over in a day to now hundreds in a day. And, that's just, I think they're going to find later on that the system has been quite abused, but that's just one man's opinion.
Sure.
And also be careful of getting offers for low health care plans that will cover you for the COVID-19 testing and things like that. We've seen a lot of that, and they're just saying, well, you can save money and get covered for this thing. Well, those are pure scams. If keep your health insurance. If you have any question about what the coverage is, and as Mary said, now testing and some other co-pays during the pandemic are covered and cannot be charged by plans. So, ask the question and then go ahead and get the testing that you need. So those are, and of course, there are no vaccines, there are no treatment options, there are no cures. So don't fall for any scams that offer that. And, And of course, in general, and we had a saying, slam the scam. So if you get a telephone call, and now most people have a Padlet, which is the number they're calling from. If you don't recognize the number, don't pick up the phone. If you happen to pick up the phone, slam it down and hang up.
That's a great reminder, Charles, of what SMP does. That the Senior Medicare Patrol is there not only to protect individuals from fraud and abuse, but to protect the system and to make sure people are aware. So if folks think they've heard of a scam and they want to contact SMP for advice, or if they think they've been victim of something and they need to report it and they need assistance with it, how do they reach out? How do they contact you?
Okay, well, we have a fraud hotline, and that's 877 SMP 4359, or they can just call our telephone, regular telephone number, which is 732-777-1940, and just ask for the Senior Medicare Patrol. We have, like 30 to 50 volunteers at any time, and they're all trained to help fight Medicare fraud, and we assign a volunteer to the beneficiary, and their job is to help assist to resolve any issues relating to billing or fraud, and help you resolve any issue, because you may be on the hook for thousands of dollars for services that maybe you never got.
That's terrific. I think you've both given such really great advice, and I hope that if people do have concerns about coverage and have questions, that they reach out to a SHIP counselor, and likewise, if they have concerns about scams or abuse, they reach out to the Senior Medicare Patrol, because that's what you're there for. And did also just want to mention that that the Senior Medicare Patrol is also available to educate. Charles, you do a lot of great education, and so if people want to have Charles do a program, please do reach out as well to him for that information and education, because education is so important to make sure that we're aware of all of these things. So thank you both for sharing such great information and keeping our audience up to date on all things Medicare.
Look at the clutter around our houses and try to get rid of a lot of those things. Or at least digitize them and get them in a place where they're not in your walkways. Make sure that you keep your cell phone or cordless phone with you at all times. Accidents are never planned. And so a simple thing like keeping your cell phone on you, either in a pocket or even an apron or a Home Depot little nail belt or something, keeping that on you if you do fall will keep that phone closer to you should that happen. If you have throw rugs, make sure the edges are tacked down so that someone using a wheeled device or you moving quickly doesn't catch your toe on it and fall. Be well, stay safe. We'll get through this together.
Thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please visit our website at www.njfoundationforaging.org and click on the Aging Insights page. We hope you enjoyed this episode and that you feel more informed about your Medicare benefits. If you have any questions or concerns, please do reach out to a SHIP counselor or contact the Senior Medicare Patrol. And remember, to find out about senior services in your area, please call the County Office on Aging. You can find their numbers on our website as well, or you can call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and be sure to tune in next time.